السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 20 in Maternity and Child Health Nursing and number 59 in Ghaith Review. Today we are going to discuss 5 questions from question number 312 up to question number 316. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 312. A 25-year-old grade 2 para 1 mother comes for a routine check at the antenatal clinic. The nurse assesses the fetal heart rate for the 38-week pregnant mother. What is the expected normal fetal heart rate per minute? The options are number A, 90 beat per minute, number B, 100 beat per minute, number C, 140 beat per minute, number D, 170 beat per minute. وقف الفيديو هنا اختار الخيار بتشوف صحيح. The correct option is option number C, 140 beat per minute. ليه اخترنا الخيار رقم C؟ نشوف rational. The normal fetal heart rate at term, which is between 37 up to 40 weeks, typically range between 110 to 160 beats per minute, BPM. So the correct option is option number C, 140. Fetal heart rate of 90 beats per minute is too low and indicates bradycardia, which may signal for fetal distress. And fetal heart rate of 100 beats per minute, although it is on the lower limit of normal range, but it may still deserve close monitoring, especially if it persists or decreases further. And fetal heart rate of 170 beats per minute is too high and indicating tachycardia, which you could suggest fetal distress or maternal condition. Question number 313. A woman has a 3 centimeter polycystic ovarian cyst. What should the nurse do? The options are number A, repeat the ultrasound after menstruation. Number B, remove it by laparoscopy. Number C, give the medication. Number D, none of the above. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number A. Repeat the ultrasound after menstruation. اللي اخترنا الخيار رقم A نشوف rational. A simple ovarian cyst smaller than 5 cm is often functional and resolves spontaneously after menstruation. And the client is need to reassessing after 1 menstrual cycle to determine if the cyst resolves on its own or not. So the correct option is option number A, repeat the ultrasound after menstruation. Surgical removal is not the first line approach for a 3 cm cyst unless it persists or enlarges or causes significant symptom. And medication is not routinely prescribed for an asymptomatic cyst of this size. None of the above is not correct. Question number 314. Nancy is a primipara who is due to deliver next week, calls and tells the nurse she has been having contractions every 4 minutes for an hour. Before asking further question, the nurse confirms that Nancy knows how to correctly time contraction, which is, the options are A, from the end of one contraction to the beginning of the next. Number B, from the beginning of one contraction to the end of the next. Number C, from the end of one contraction to the end of the next. Number D, from the beginning of the one contraction to the beginning of the next. وقف الفيديو هنا نختار الخيار اللي تشوفه صحيح. The correct option is option number D, from beginning of one contraction to the beginning of the next. ليه اخترنا الخيار رقم دي؟ نشوف rational. The correct way to time contraction is from the start of one contraction to the start of the next. This measures the frequency of contraction, which is critical for assessing labor progress. So the correct option is option number D, from the beginning of one contraction to the beginning of the next. The remaining options are incorrect because they do not measure the complete interval between contraction. Question number 315. A 22-year-old gravid 2 para 1 at 38 weeks is admitted with decreased fetal movement. A non-stress test reveals decreased variability. The next morning, the nurse detects a fetal heart rate of less than 100 beats per minute. Using a Doppler, what should the nurse do first? The options are: number A, reassure the mother that the fetal heart rate is okay. Number B, notify immediately the physician or midwife. Number C, reposition the patient to left lateral position. Number D, ask the mother about the patterns of fetal movement. وقف الفيديو هنا اختار الخيار بشوف صحيح. The correct option is option number C, reposition the patient to left lateral position. ليه اخترنا الخيار رقم C؟ نشوف rational. The left lateral position improves uteroplacental perfusion or blood flow and may help increase the fetal heart rate by optimizing oxygen delivery to the fetus. So the correct option is option number C, reposition the patient to left lateral position. Reassure the mother is incorrect because the fetal heart rate is not within normal to reassure the mother. And notify the physician or midwife is important, but repositioning the patient is the first or the priority action to potentially improve the heart rate, and then after you contact the physician or midwife and ask the mother about the pattern of fetal movement, also important, but it's the secondary, not the priority, as the decreased fetal heart rate takes the priority. So the correct option is option number C, reposition the patient to the left lateral position. Question number 316. A pregnant patient is admitted to triac with abdominal pain. On assessment, the fetal heart rate is 70 beats per minute. What is the nurse's first action? The options are: number A, call the doctor. Number B, report the finding. Number C, put the patient in left lateral position. Number D, reassure the mother. وقف الفيديو هنا اختار الخيار بالشوف صحيح. The correct option is option number C. Yes, put the patient in left lateral position. ليه اخترنا الخيار رقم C؟ نشوف rational. A fetal heart rate of 70 beats per minute is significantly below normal, indicating fetal bradycardia. The left lateral position improves blood flow to the placenta, which may help resolve the bradycardia. So the correct option is option number C. Put the patient in left lateral position. Notify the doctor is necessary, but the positioning is the first, and then after you can contact the physician. And report the finding also important, but after taking immediate action to improve the fetal heart rate, and after contacting the doctor, and then after you have to report your finding. Reassure the mother is incorrect, as the fetal heart rate is not within normal. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to us by comment, like or subscribe.